Hey there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Again, apologies for my lousy choice of names for this podcast. But since we're doing it for over 5 years, I can't change it now. So please bear with me. All right. What are we going to talk about today? One of my favorite topics to talk about and my favorite things to treat are headaches. Okay. And I'm going to go over a little bit of anatomy. I'm going to try to keep it simple, much easier to understand if I keep it simple. But what I want you to do is I want you to take your hand, put it on top of your head, and slide it down as far back. And you'll feel a little bump, and after that bump, you'll feel a little hole. Not really a hole. It's a space between your skull and the upper cervical spine, okay? And what you've got going on there is the cerebellum, you have the brainstem, all these important tools, or important structures. And when you have a blockage there, it kind of crowds you up. It doesn't let it's like a plug, and it blocks the flow of cerebrospinal fluid. Now, what's the importance of cerebrospinal fluid? That's like it's like your head is floating and your spinal cord is floating within this thing called the meninges, which is a very nerve-rich covering to the brain and to the spinal cord, and very, very sensitive. So when you ding the meninges, you're gonna feel pain, okay? But what I want to talk about is hydrodynamics of the CSF, the cerebrospinal fluid. When the CSF cannot flow freely through the foramen magnum, which is a hole at the bottom. Like I said, when you put your hand on top of your head, you slide it down, you feel a little divot. That's where the foramen magnum is, probably about an inch and a half inside of there. So it's soft right there because you have the brainstem is right there. So what happens is when you cannot, if the occipital bone is not positioned properly, you're going to have a blockage of the CSF. And this blockage creates what they call a water hammer effect, in that it creates extra pressure and stresses the cranial vasculature, which can cause a headache. So this is not something you're going to see on TV for an Advil Aleve or a Botox commercial or whatever new medication they're coming out with. But try to understand something. Pressure at the brainstem is a big reason people having headaches. It's also one of the big reasons why when we treat headaches here at Core Health, that we actually can make a difference, a profound difference in the quality of life, improve sleeping, improve posture. It's a pivotal area. So if the CSF is blocked from either occipital bone being out or the atlas or the upper cervical vertebra, you can have headaches. But your doctor's not going to tell you that because they don't teach you in medical school. This is a foreign concept on, there's surely enough pills to take, and that's what people learn in medical schools to give it. So understand, CSF needs to flow freely. When it's blocked, it creates a plug almost, and that puts extra pressure on the meninges, which is that sensitive lining of the brain, outside of the brain, and it stresses the cranial vasculature. So what happens here is you have to understand that there's dopamine production is in the brainstem too. So we're talking about the brainstem, but the brainstem, when it's affected by misaligned bones in the occipital area or the upper cervical area, are problematic in many ways. I want you to think, I'm sure by now you've heard about dopamine. If you haven't, now you have. Dopamine is a neurotransmitter, and it's a pain gatekeeper. And here's the interesting thing is, now I'll make this stuff up. Research shows that dopamine levels fall significantly during migraine attacks. Okay? Now, here's something you also have to know is dopamine typically helps inhibit pain signals in the trigeminal area. A lot of trigeminal nerves are some of the nerves involved with headaches. That so I'm not about to come up with anything, life altering information. This is all the research. I don't make any of this up. So now what happens is the dopamine is produced in the brainstem. And if you're not producing enough dopamine, that itself can lead to a headache. Okay? So what I'm trying to get at here is you think about going to your chiropractor for your headaches. It's not something people go to first. You have enough people, medical doctors are not trained to diagnose when you have problems with the bones. If it's a fracture or a tumor, yeah, you go see them. You don't see me. But if you're having headaches and you want something to do differently or try, it would make sense to go to a chiropractor and have them take a look at it. I mean, because here's the thing is, you take a medication to alleviate your headaches, your Advil, Aleve, your Botox, all these. There's too many of the newer things coming out, like whatever one of the Kardashians is promoting. All these different things are to help with headaches. They don't cure headaches. And I'm not saying I cure headaches either. What I do is I take the pressure off so you don't have a headache. Okay, so the end result is you not having headaches. How I go about doing it is very different. It's natural. It frees up stuff. It lets you produce dopamine. It allows for proper flow of the cerebrospinal fluid. Okay, so but I'm trying to get a little bit of this. Most of your dopamine is produced in the brainstem. So if the brainstem is getting clipped on by either the occiput or the upper cervical vertebra, you're going to have less dopamine. But also, too, is dopamine is also produced in the hypothalamus. And in the hypothalamus, you have inhibitory nerves that suppress pain. So if the foramen magnum is blocked under high pressure, it disrupts this normal descending, going down from the brain down to spinal cord pathways. And it also messes up the regulation of dopamine production. So when dopamine production is low or fluctuating, the brain becomes hypersensitive to sensory input, light, sound, touch. Call that allodynia. I guess I'm trying not to get too big with the wordage here. So bear with me. And if you have any questions, you always give me a call, 203-656-3636. All right. So the connection here is the blockage at the foramen magnum causes physical stress and pressure. The pressure disrupts the delicate neurochemical balance in the brainstem and the hypothalamus. Dopamine production drops or fluctuate. The pain breaks are removed, turning physical pressure into chronic hypersensitive headache cycle. So I'm just encouraging you to think outside the box, because when you take a pill, listen, if it makes the pain go away, you're happy. But what happens is you have it affects you. I mean, if you just put a piece of duct tape over the oil light in your car is still going to run, but it's not going to run right. And what happens here, medication does that. It covers up the symptoms. And everybody claims that they remove the symptoms. Well, I don't remove symptoms. What I do is I remove the blockage that is causing the symptoms. So it's a little different approach. And it's a common sense approach, because I can't tell you over the 30 plus years of practice how many people I've helped with headaches and why it's one of my favorite things. Because one, it's kind of easy. I do this for a living. I know when to see a headache, I can help. And basically, I want to make sure you understand, chiropractic care for headaches is safe, it can be comfortable, and needs to be effective. I mean, you operate within that hallmark, you can have a very successful result, which is a happy patient who's going to sleep better, less brain fog, less headaches, more living. If that's what you're interested in doing, I would suggest. And if you're outside the Stanford, Darien, Norwalk, McKay area, give me a call, 203-656-3636. Ask to speak to me. I'll probably have to call you back after hours or a time when I'm not seeing patients, but I'm more than happy to help. Headaches can be helped, and hopefully have a little bit more knowledge, because there's no pharmacological thing I've outlined here today that's going to make a difference. But the idea here is by removing pressure on the brainstem, you can have great results, and I hope you do. Thank you very much.